Now, in the meantime, the inaugural Africa Health Indaba has wrapped up in Johannesburg. Government officials and pioneers in the medical industry from across the world were there. They're looking at ways of accelerating affordable and quality healthcare to tackle a disease burden that's growing heavier year after year. The Indaba took place during the annual Africa Health Congress. CGTN's Julie Shire was there.
Attendees at the inaugural Africa Health Indaba called for more and speedier investment in primary care. Throughout Africa's history, healthcare has been shaped by epidemics and health crises, with little focus on the growing disease burden. This, they agreed, has to change.
High levels of communicable and parasitic disease are being matched by growing rates of chronic diseases. Healthcare delivery infrastructure is insufficient. Skilled healthcare workers and crucial medicine are in short supply.
South Africa and Rwanda are the only countries to have met the 2001 Abuja Declaration, which committed African states to allocate 15% of their spending on healthcare.
Governments are spending something like $3 per person per capita on primary health care, whereas people are pulling out of their pockets $8. So this speaks to the fact that there is money and governments are just not managing the taxation well enough and the systems well enough.
We need to leverage the South-South partnerships in the context of BRICS. We've got the new development bank within that particular arrangement. How is that new development bank, especially now with additional partners that have come into the picture, how are we leveraging our own money, our own resources?
A larger focus has been placed on healthcare since COVID-19, but more needs to be done to achieve universal coverage and cut reliance on outside countries.
It was during COVID that we realized that if you don't have any internal capacity, you will struggle. We became beggars while we have money. We have trained our people, engineers, doctors, everybody. And now we need to develop our own equipments and even our own pharmaceuticals.
A lot of your local manufacturers have got the ability to produce, but they often need the investment to give them the funding to be able to get them to register their products so they can go into the market.
The United Nations General Assembly's 78th session this year called on states and governments to accelerate progress towards the achievement of universal healthcare by 2030, which has derailed since the COVID-19 pandemic. Despite efforts to boost healthcare systems, since the pandemic, the continent remains vulnerable to disease outbreak. Julie Shire, CGTN, Cape Town, South Africa.